Welcome to this patient video on transurethral laser ablation of bladder tumours. This is essentially a simpler way of treating bladder cancer in an outpatient setting using a laser to deliver energy to destroy a tumour in the bladder. To understand what this procedure entails, we wanted to share some of our and our patients' experiences around TULA. I guess me as a clinician, I'm always about trying to simplify things down to what we can make it as easy as possible for our patient group. And actually for a patient, bladder cancer is one of those conditions that for the majority, 90% of patients, it's low risk. But these patients will get recurrences and they can get them for several years, 10, 20, 30 years. And it's trying to reduce the morbidity around the procedure and simplify it.
My first encounter with the bladder cancer would have been about 20 years ago. And I immediately went to my GP, who referred me to a urologist, and I was admitted to hospital and had to have a general anaesthetic.
Following the surgery, there was a follow-up endoscopy, cystoscopy. I think it must have been about, 3 months after, something like that.
And they found 2 areas that needed attention. So the doctor told me then, okay, you'll have to come back. And my first question was under general anaesthetic? And he said, no, if you want, we have a new procedure now.
I decided to go for it, and really it was absolutely amazing. I felt very fortunate to have a choice. And yeah, it was painless, the whole thing.
The procedure is essentially designed to simplify everything. And it's essentially like you or I going to a clinic consult, but having the small procedure and then being able to walk out and get on with life.
So on the day I came, it was really like a flexi.
It was very closely explained to me that the instrument would be inserted into my bladder as per normal, and the biopsy would be taken, and that I might feel some pressure from water.
The nurses will ask for a urine sample just to make sure there's no infection there. And then from there, with the consent done, you'll go into the procedural room. They'll ask you just to undress from the bottom half.
And then we were all given goggles to wear that were tinted, and I had some as well. And I just lay there feeling so confident and comfortable. Well, I think I probably commented it was a bit like laying on a beach in the sunshine, it really was.
We use a local anaesthetic gel, which just numbs and lubricates things. But again, there's no needles, there's no injections, and it's very, very straightforward.
And it was totally painless. There was absolutely no sensation, even when the laser was being operated upon. I was seeing it through a separate monitoring system, and so I was able to observe, quite candidly, every step of the procedure.
The actual lasering time is between 5 and 10 minutes maximum, the actual turnaround, in terms of the procedure coming in, having it done, going, passing water and going home, about 45 minutes or an hour. So it's a million times better than a whole day getting up at being in hospital for 7:30 in the morning, then being able to go late in the evening, having someone to drive you because of the general anaesthetic.
It was finished and I sort of bounced off the table. I was given a stat dose of antibiotic. A discussion took place. I drank plenty of water and my daughter took me home. Well, in future, I would just drive myself.
My procedure was in the morning, and after the procedure, I went straight home and carried on as usual.
I think all the patients who have had the TULA procedure would probably say that they would never go back to having a general anaesthetic again.
I wouldn't really want to go for a general anaesthetic and the old way of doing things. It almost would be a retrograde step for me.
I'd really recommend it. Why not? It's absolutely super stuff.
For me, it's no-brainer. It's it's quick. It's easy for me, and it takes the worry of waiting for GA and recovering from the GA as well.